interested in looking at why clinical trials are inefficient in the United States or in general, and what barriers there are to enrollment on clinical trials. Classically defined barriers to enrollment have had to do with patient awareness of clinical trials, with their acceptance of enrollment on clinical trials, or their eligibility for enrollment, but there's been much less work done focusing on availability of cancer clinical trials. And so what we wanted to do was look at clinical trial sites throughout the United States that are actively conducting clinical trials in prostate cancer, and we actually looked at breast, colon, and lung cancer as well, and asked the very simple question: how far would an individual in every zip code in the United States have to travel to access their closest clinical trial site? And it turns out that a large proportion of the population would need to travel greater than 30 miles to reach a cancer clinical trial site. 30 miles might not sound like a lot. 10 miles is actually the average travel distance people in the United States travel for medical care. There's been some very nice studies done showing that travel greater than 12 to 15 miles decreases the likelihood of pursuit of specific medical interventions, and greater than 30 miles has been used to characterize high travel burden in prior studies. So we think that this demonstrates that a large proportion of the United States simply has poor geographic accessibility to clinical trials, and that's a clear barrier to getting our trials accrued.